Good. Lovely. Okay. So yeah, Council of Governors, welcome. Apologies for absence. There's a number of apologies from governors which are logged already with Adam. We've got Anna van der Gaag. She has sent her apologies. Very good. A daughter's wedding, big thing in the family. And Nitin, he has sent us apologies. I got an email earlier from him, but it was sent at 3:30 a.m. To tell me that his second baby has been born. And of course,
wow.
that's what happens when the babies, isn't it? You know, you're up at 3:30, 4 o'clock. So bless him. So that's good news. And so Core So we there's quite a few apologies now. I think there's a number of reasons for this. So we've gone virtual today, which seemed very sensible, a good call by the governance team. We've got elections coming up. We're down on staff governors, a couple of people on holiday and family emergencies come up. So that's the reason why we're not quorate. There's one report we've got which is for approval, but we can do that by getting your approval from it here, but also ensuring that we get the staff governors agreement in writing. So we'll do that separately. And we've got elections and you know, it's fantastic you're here. Thank you very much for governors that are. We're really keen to, as you know, over the last year, been trying to work very much more closely with you, and we need to make this we need to make these meetings and committees right for you to come to, and you want to join us. So we've got the elections coming up. Great opportunity to get some interest in increasing our governor base. I know we've got some exciting plans to ensure that with staff governors, which we're increasing, and we'll make sure that it's worth applying to be a staff governor. We can get the numbers up a little bit. However, we're here and we're very grateful for you. We've got quite a bit of business to deal with. I don't know if it'll take 2 hours, but we'll go through it. And declaration of interests. Anybody got any declaration of interest? I'm assuming not. Minutes of the Council of Governors held on the 10th of February. Can I take them as approved? Thank you, Catherine. Thank you very much. And we don't have any questions for members of the public. And it's I will just go through my chair's report. You've seen the report. And I think a few reflections, given it's a year in. It's been an incredible year and it's an incredible organisation. Oh, sorry, Catherine. Yeah, please.
No, it's a matter arising from your report. So I didn't know if you want to wait till you get to the Millview bit or for me to talk about that now.
Why don't I go through it, Catherine,
Yeah.
And then we'll talk about Millview. And I had thought we'd ask Jane to give us a quick update on Millview as well, so we can get a full comprehensive picture of where we're at for assurance. So yeah, reflecting on the incredible organisation. Thinking back when I first came in, there was a number of challenges. One in particular was the financial challenge ahead of us, which we knew was going to be at least a 2-year period. So we've got another challenging year to come. But let's just for the moment stick with reflections. And of course, as you heard and you will hear later, we've achieved the financial target, which is an incredible achievement for the executives and all those involved. But it takes an awful lot of hard work, and it takes imagination, it takes creativity, really intelligent design for transforming our services, which I've seen happening, behind the scenes, and also working with the execs going forward during that year, and it has been quite incredible. I do want to say that these challenging times they've not gone. We're going to have a couple of more years ahead of us, and then to predict the future thereafter, I don't know, but certainly you'll have seen all the announcements made by the NHS, and they're really important. They all have implications for us as an organisation, which is why it is important for us as a unitary board backed up by you as governors to be thinking about the future really carefully. NHS England will go off into Department of Health, which in itself has implications for us. We've got the reduction in integrated care boards, by 50%. And I think some of us met Jim Mackey, the new interim chief exec of NHS England, last week. I know Jane's got a meeting with him coming up this week. It's really quite important because he's making these announcements. And actually, when we heard him last week, he is a very he doesn't hold back, and he tells a truthful picture. He tries to be honest about the situation, and he matches it to the global economy being a real challenge at the moment. We don't have any money. The country and the treasury are struggling with balancing the books, as we know. None of this is a surprise to us, and of course that has implications for us. We've had years of some growth, which has been incredibly important, but that's stopped, and that really, really has stopped now. I mean, we've heard these messages before, and I've been around a little while, and sometimes you hear there's no more money, but miraculously some comes when there's a crisis, but there really isn't, and we're really pushed to make sure that we can provide good quality services at the very least amount of money, which is what's going on at the moment. So I think that what I would say about this organisation is we think of the future, we try to be future proof, and we think about transforming services, modernising services, and not just doing the things that we've always done. Some of them don't work very well. We put a lot of money into it, which is what we did, our transformation programme. That's really important to us. And I think the last thing to say is that the politics is really quite, the NHS and wider politics is full on at the moment, and it's requiring the executive team and some of us as non-execs to a lesser degree to play the politics and work within the politics, and it's tough because some of it we don't quite know what's going on. We're a system, an integrated care system with significant financial issues, and everybody knows it's mainly the large acute hospitals, but that does mean that we're part of the system, and that does mean we will be scrutinised as well. And we have to play the politics. We have to play the fact that we run a mental health organisation. We need to protect the mental health spend and the value of mental health, but also we've got to play our role as system partners, and that's not easy. And I think when we're looking out for you as governors to hold us, the non-execs, to account, just a small steer for me is also hold us to account for how we are supporting the execs in these times. We're a unitary board. We should be supporting each other, but I think that is quite important because it is pretty tough at the moment. And I've been an exec for so many years. I think I have I'm able to have a view on that. I'll try and briefly go through the rest of it. Council of Governors appointments. So thank you very much, Keith. And of course, Sarah. I know, a lot of this is not new at all, but Sarah and Catherine, our lead governor and deputy lead governor, brilliant. We're so pleased, and we'll look forward to working with you and making this, just getting this Council of Governors working even better. And making sure that you feel that you're exercising your role as governors. And the Board of Directors appointments, we have made Simon, who's here, appointed Deputy Chair, and Nitin, reappointed as non-exec. Abiola, who's with us, non-executive director. She was previously an associate. And you'll know, because you've approved all this, thank you, is Dr. Colin Hicks, appointed as a voting board member. And Kevin Crowley, non-exec, will be leaving at the end of the month. I don't think Kevin's with us at the moment, but he's going to come a little later to present a paper. The rest of it, we've had a couple of joint council meetings, and we've had a board of directors workshop to look at our board assurance framework, and linked that to the strategy that we've approved going forward. I suppose a quick note, I always like to give an update on the integrated care system. I mean, it's challenged at the moment because our integrated care system, and Jane is a board member, just to remind you, represents mental health, not just a trust, but mental health. The ICB, that we need their leadership, but the main chief executive, of course, went off to work for the for NHS England, got interim arrangements at the moment, and they're under a lot of pressure to downsize and save money. That's just the reality, So it means that we're probably not going to get the steer and the leadership from the system that we thought we might get, but we'll work with them very closely and help them through it. There is a Sussex Provider Collaborative. I always say this, you'll know about our mental health provider collaborative because we lead it. But the Sussex Provider Collaborative is a new one where the providers in Sussex are collaborating together to be more of a united force going forward. It's really important. And just to say, that's developing as time goes by. And Dan, our communications guy, is going to provide a little bit of support on their communications. Our charity, really, really important to us, and we've launched the strategy. And as you say, Catherine, we've had a Care Quality Commission report. It's there, Millview. After the investigation, as we know, the CQC has gone through incredible change themselves. So there's been a year's delay on that report. We'll hear, Jane will give us a view as to what's right up to date on the executive side, but I will say that it is pleasing to see that we'd spotted some of the concerns. In fact, we contacted the CQC about our concerns. They then came to do a visit. We'd already set up an action committee, but we just need to make sure that action committee, and of course it was safety that they marked it down on. Which is, of course, a concern. And just based on that, there's some changes at the CQC. Chris Tzadiki is an interim. He used to be the mental health director. He's now the operations director for the CQC, so right up at the board there. Friend of mine, I met him fairly recently. These are really important connections because we just, it's just good to hear what it is that the CQC, particularly what they're prioritising at the moment, and have a relationship with them whereby we can talk to them about our concerns at an earlier stage. You'll see a lot of the work we've done there with parliamentary engagement, which I'm very pleased about. And there was a Coombe Valley Summit, which I'm hoping, Catherine and Sarah might want to say a few words about that. And then the governor's elections coming up. Well, it's quite a report, actually, so I'm going to stop and throw it open. Catherine, please.
Yes, I'm very concerned about the Millview comments. And I'm also concerned to hear again being told, well, since the report, everything's got better, because there have been so many serious incident reviews and learning from deaths from coroners' reports, and it's the same things that have come up. And one of the we failed under section 12 and section 17, and section 17 is good governance, so obviously that impacts all of us here. And we're talking about staff training yet again. Is it the same staff? Have we got just a constant churn of staff, so we're constantly having to train them? What training has happened and what's been learned? Really, really disappointing, especially from my personal point of view. It's having systems in place, but it's also basics like the ward wasn't clean. We've got short staffing. Patients don't feel safe. Environment, which I talk about all the time, noisy and chaotic. And I would be very concerned if there were still some staff there that were there in 2022 who blatantly were not, were economical with the truth, shall we say, at an inquest I attended. And if they are still there and in leadership positions, I'm not surprised that we're not getting any progress. So, I'm being measured, but I am incredibly disappointed. And I wonder if this is just an issue with Millview, or if it's a wider reflection of sort of practice and that, because as governors, we need to have that assurance and reassurance that, people are safe and people are cared for. And, with our new strategy, there is that compassionate care. And unless we change some of the people that are these negative culture carriers or even negligent people, how can we be assured anything's going to change? Sorry, it's a bit of a long rant, but I needed to say it.
Catherine, it's absolutely fine. It's really good. I'm really pleased you said it. And that is your role. You know, you've got to tell us your concerns and why you know that you're disappointed. And you know, we need to respond to that. I'm going to ask Jane to say a few words, but also if any of the non-execs would like to say something around, you know, the governance side of it and our discussions at the board and the quality committee, etc. Just have a little think about that. Jane.
So thank you. And I welcome your questions, Catherine. So never apologise for asking those questions. I think they're really important and that's part of your role. So please never apologise and never shut up, because we won't stop learning until, you know, the danger is when people become quiet. I think that's when the risk is, not when people speak up. So please never apologise. So I've said that and I absolutely fully mean it. Obviously, the report was incredibly disappointing. It was not surprising at the time because we had concerns that some of the stuff that we thought were embedded was highlighting to us again. So it speaks to the governance side of things. And we actually rang CQC and told them that we were concerned, which then triggered the inspection. So one of the things that I take as a positive out of this is that this was not a result of a death on the ward. It was not a result of something that had happened and they came in. We invited them in because we had concerns that we weren't being, that some of the learning we thought had been embedded hadn't. We have been on a long journey. The report was 11 months ago, which is completely unacceptable. And we've addressed that with CQC, because how can you turn around that learning and be transparent with carers and families if you're not being open immediately after an inspection? There have been changes in the staff. I can't say hand on heart, Catherine, whether I know it's all completely changed, but there have been some performance stuff that we have dealt with. And that has, and it really speaks to our new accountability value. And that's going to be really important to me. There's accountability and compassion and optimism has to come with personal responsibility and organisational responsibility, openness and reflection when we don't do well. And that goes for all the wards at Millview and across the whole trust as well. And one of the things I'm talking about at the moment is the quality of our quality review visits that we do and whether they are reflecting the actual reality in real life. So there's some work there. I would suggest as well as governors that there are questions that you could ask from the quality committee to look into and deep dive into and report back here as part of that governance and assurance process, because that's where the governor's assurance about this comes from. But I commit, Catherine, to be open and honest about what's happening, even when things are difficult, and hopefully that will bring about change.
Yeah. So
Thanks, Jane.
Yeah, and the point Jane's saying there about you not don't ever feel bad about apologising and keep saying it. It's right. That's why this is set up. This is part of the governance. You really do need to, but you need to see some improvements as well. I think that's a good point about the quality committee. And we'll come. So, as would you believe it, Kathy? I know Anna's not here, and Kathy, you sit on the committee. Yeah, please say a few words, and I'm going to ask Simon as well, and then we've got Julie. Yeah. Kathy.
Yes, I mean, I was just going to reiterate exactly what Jane was saying, really, and the importance of the quality committee. And we've got two governors sit on the quality committee and observe our proceedings and get the opportunity to comment in this meeting. So that's Jonathan. I'm not sure Jonathan's here today, and Adrian Worrell. So there is that opportunity. So I guess for the governors, that would be, you know, they could act as your conduit, your channel, and if there's things that the governors would like us to look at, particularly in quality committee, and as Jane said, with the scope for some deep dives, I'm sure we'd be very happy to do that. So in terms of the governance, I think the role of the governors on the committee is really important.
Julie, you had your hand up? Has it been covered?
Yes, no. I just wanted to follow up there from what Catherine was saying. Just to ask the role of the non-executive directors on the board, how involved are they on site to parts of the hospital that are not doing so well, and what was their role with Millview in the past year, and how is that communicated back to governors?
Did you? I don't know if everybody got. Could you say that again, Julie? The line just went blank
Oh,
a
I'm
couple
sorry.
of times. Sorry.
That's okay. Can you hear me?
Yeah, I can. Yeah, just a
so-
little bit broken, but we can hear you.
Okay. It's the role of the non-executive directors on the board, and how involved are they in parts of the hospital that are not doing so well, and how is that actually communicated back to us as governors? Obviously, we hold them to account, and they hold the executive to account. So if you could share with me how that actually worked around Millview and how that's communicated back.
Yeah, so I'll start, and then I know Simon wants to, and Abiola. Yeah, we'll zoom in and we'll prioritise the areas that we're concerned about, and we've got good systems in place. I mean, really good systems in place via the Quality Committee to identify where there are concerns and where there are problems, and we will, the Quality Committee will identify that, and then the board will then get areas of concerns that are sort of like summarised, and what we're doing about it. And then, of course, during the board meetings, board committees, and outside that, we have the opportunity to question, challenge, and support our execs in making the improvement. How do we report that back to governors? Well, here's a good example, and that's why we're talking about it now. But we might like to review that as we go forward. Is this sufficient? That we've got elections coming up. We're a year into Simon's report on the governors and how we work together. It may be that we feel it's not, there isn't sufficient time to bring these things and update you as governors. If so, we'll review that. Can I go to Simon and then Abiola?
Thanks very much, Sean. Catherine, I just want to again emphasise what everybody else has said, which is the challenge is welcome. It is exactly what this is here for, and really important that we each, where those specific points come up, that we do zoom in on them, because it just makes sure that we get that focus. So thank you for doing. And then I think to Julie, to your point, I think it was the last full board meeting where Jane talked to us about visits, and we also had talked about the link between the previous issue and governance. And I think that bit about closing the gap and thinking about where we prioritise the NED visit and how we make sure that is communicated back in the right way is the action which I think that we should be taking from this. I know that it's really, visits are really time consuming for people. They're a really important part of the process, and I think there's a bit of work that I certainly feel from my end as deputy chair that I think would be worthwhile for us linking across the Quality Committee to the visits and then back through to the reporting, and where we've got areas that we maybe need to focus on within the organisation.
Yeah, well said, Simon. And the visits are so important. I've been to Millview at least once. I've been for a proper visit on one occasion, and we'll be going back there. I was talking about the CQC Director of Mental Health. One of the things he said was that the non-executive visits to services are really, really important, because you hear all the reports, you see all the Quality Committee reports and information minutes, etc. But there's nothing like going in there and talking to service user carers and staff. Abiola.
Hi, actually, Julie, I wanted to just, to follow on actually from your question, because I'm not on the quality care quality committee, and so as a NED, I do feel that the thing that you raised, that maybe I haven't been as useful in my site visits, in terms of knowing that I'm going to a place that already has a problem and knowing what questions to ask. So actually I think it is something that that we have talked about on the board, and you raising the point again makes me raise that point again, so that when we do go to our site visit, that we are told, actually, this is a place that we want you to go to because this place has a problem, and these are the sort of questions we want you to ask. At the moment, to be honest, I don't know what, how the other nerds are doing, but I do tend to find I just go in and I'm just generally asking questions and generally trying to, figure out what's going on. But then I think that maybe I might be missing something if I knew that there was a problem there. So, I do appreciate, you for bringing that up. And I can say maybe definitely from my point of view, I probably haven't been doing as much as I would like to on that.
Abiel, I'm really pleased you said that, because it got me thinking that as chair, one of my roles is to set the standards. And if I was to pick up any defensiveness or dismissal of what's been said, or question Catherine right at the beginning, I would be extremely concerned. And what I'm hearing is the opposite of that, wanting to, hearing it, accepting it. I feel a level of guilt. I used to run services. We don't want this sort of thing happening. So we will put all our efforts into making improvements. Of course, what we know is that sometimes that takes time, and it is quite complicated, but we wouldn't give up. I'm going to have to draw this to a close, but I'm going to give Anil a chance to come in. Anil, please. Oh, and then we'll let Jane finish. But Anil?
Fair. My apologies. I'm travelling today. Can you hear me, Chair? Hello, Chair?
Yes, I can hear you, and you look pretty cool. Yeah.
Can you hear me, Sean?
Yeah, it's breaking up, but we can hear you. Try it, Anil. We can, but
My apologies. Well,
I'll tell you what, Anil. See how you go. We'll come back to you. We'll just take Jane's point, and then we'll come back to you before we close down this report.
So I think it's important to say that we need the NEDs to visit everywhere, not just the problem services, because you need to listen to the whispers in the wind before they become storms. And there's a risk of closed cultures if you only go places that are considered a problem. In a way, they're the ones where they've got the most eyes on them anyway. So the other bit that I'd say is that as part of our continuous quality improvement journey, we're going to start thinking about a framework and a purposeful NED and exec visits that look at quality improvement and focusing on what people are asking and looking for when they're on site visits. And that's going to be part of our CQI journey this year.
A great point. Adam, the continuous quality improvement program that we're embarking on, I think we've updated the governors at a meeting, but offline, let's just make sure we do that, because it's so important that we should let the governors know exactly what we're doing. Anil, do you want one more go?
Yeah, thank you. Can you hear me now, Sean?
Yes.
Good morning, everyone.
Morning.
I can only echo what's already been said. A number of things in no particular order. One, that which Catherine has set out, those queries, I'd be really grateful at board, if not certainly quality committee, for answers to those specific questions. Secondly, in relation to Julie's point and the more general point about how do these things work and visit, I think we can fortify what we're doing and how we're doing it, not least by ensuring, one, that visits are not voluntary, but they're mandated, i.e. by NEDs. Two, that they're scheduled, those planned visits are scheduled long in advance and they're not cancelled. And if they are cancelled, there's blooming good reason why. And three, that there are ad hoc visits, so that when we go in, we're not smelling freshly painted walls. I think those things might help us as NEDs ensure that assurance is elevated, so that we can then communicate back to Julie's point in the way that we must and should to our member colleagues.
Great, Anil, thank you. And as Jane says, we're going to be reviewing the system for visits, and we can incorporate what you said within that, because it's very sensible indeed. Thank you so much, everybody. Sarah, your first, I think, lead governor report.
Thank you. And can I just say before I start, I'm really heartened by I didn't get a whiff of defensiveness in anyone's responses to Catherine's challenge there, and I find that really heartening, and so thank you for Catherine and for everyone's response to Catherine. Hang on, I've got so many tabs going here. I'm trying to find the right one. Okay, so yes, it's been a few weeks since Catherine and I were appointed, and this is my first lead governor report. So I just wanted to say a massive thank you for all the work you're doing. In terms of governor activities, we had a joint board and council strategy session on 24th of Feb, where we talked about the delivery plan for the trust organisational strategy and how the council of governors are going to play a key role in holding the non-execs to account. We had we did some interviews for 2 non-exec positions on the 9th of April, and I just want to say a huge thank you to the governors who took part as panel members. We saw some great people. I said a number of times that there were lots of applicants. The standard of applicants was very high. We had an A, B and C list, and even the C list candidates, you know, had great CVs, saying that the 2 that we selected and putting forward for your approval, you know, that it was a clear decision. There really wasn't much cause for debate on this, because it was fairly unanimous that we all kind of felt that they were the two strongest candidates. The other thing is there was a devolution roundtable invite, which was scheduled on the 9th of April for West Sussex constituency public governors to attend, but it had to be cancelled because of the NED interviews. And we've been allocated 2 places for the Governor Focus Conference on the 5th of June, so I'm looking forward to going to that. And that's all I have to say. Thank you.
Great. No, that's good. Good. Thank you very much for that. And I think we've got a meeting with you and Catherine tomorrow or later in the week where we can look at, I think also, you know, the staff, the governor elections coming up and how we can drum up enough interest, etc. for that, so we can get a good base of governors for you. Great. Any comments, questions from anybody? Okay.
Can I also just say a big thank you to Catherine for all her support, and ask if she's got anything to add to this as well.
Thanks, Sarah. No, I think you know, it was a great experience actually being part of the interview panel for the NEDs. I think we worked really well across you know, the different elements of the panel. It felt professional, and interviewing 7 people in one day, you know, it was quite daunting. However, it just ran very smoothly, and everyone was able to express openly opinions, even when, you know, it was quite interesting some of the differences there were, but you know, no punches were thrown, which is great, and the sandwiches were good too.
And I loved how you were. I loved also how you were quite persistent, Catherine, in challenging acronym usage.
Yes, yes, because if I don't know what the hell it is, then no one else probably does either. And I'm quite happy to be the fall guy and say, sorry, I'm a bit thick, don't know what that is, you know. So yeah, and working in local authority as well, they're everywhere, and education is terrible. But yeah, and thank you, Sarah, for stepping into the role, and I feel very positive going forward, so that we can even further sort of bolster the working relationship and the support and challenge elements. So yeah. Great.
Yeah, thank you, Catherine. I agree.
So that brings us nicely to the Nomination and Remuneration Committee, which I chaired, and we took the so out of the 7 that were interviewed down to 2 that we proposed to be appointed as non-executive directors. That's Cheryl Lee and Lynn Hunt, and we approved it at the Nomination and Remuneration Committee, and we need to get that endorsed here. Just to say that, yeah. But the whole process was good. Actually, it could be challenging because we had a recruitment agency. We have obviously our governance team leading it and helping us do it, and of course we need to include HR. So you know, there could have been there could have been a risk that, you know, duplicate or we miss things out, but no, actually it all worked. All those three departments worked very well together. These are really important posts, really, really important. Just based on that last conversation, the question that Catherine asked about Millview, that's why we have to take these, we want to take these very seriously. And with Stephen Lightfoot, the chair of the ICB, he didn't delegate it, he came along himself to be part of it. Really, really good candidates. It was a very difficult decision indeed. Catherine, you not only were you good at challenging about the acronyms, you were really good at challenging, and I mean this, you know, because a couple of things that I had training just beforehand, and you know, the unconscious bias where you sort of might not know that you're responding more positively to one candidate, you know, and I think I did that, and Catherine was absolutely brilliant and challenged me. And it's all about, you know, it's all about learning, isn't it? Whatever level you're at, and doing things differently. And it was really good, and just felt that this tone was set nicely, that we could challenge each other, and I think that makes for a good decision making. So Cheryl Lee has a people's background. So you'll recall, it's in the papers, there were two sets of skills, if you like, we were looking for in particular. One is around quality, and the other one is around staff and people. And Cheryl, so there were sort of two parts to it. So Cheryl Lee was the person we put forward to that, and she's runs her own company now, has worked in the NHS and various other organisations, has worked at the level of Chief People's Officer. She's very dynamic, really, really committed, and will be an excellent addition to us. And Lynn Hunt is, some of you will know, was the chair of Southern Health, which has now been incorporated into a larger Hampshire Isle of Wight organisation. But Southern Health went through really, really difficult period for 3 or 4 years, and Lynn, with a couple of chief executives, helped get it from on special measures from the CQC to good, and well respected by her peer group, and will be a good addition for us. So we're asked to approve the recommendations of the two people that we're putting forward, and approve the remuneration and recommended candidates. If I get the nods, then what we then will have to do is to ensure that we write out, particularly to the staff governors, to get their approval. Adam, what have I left out?
No, nothing, Sean. It was just, what we'll do is we'll ask all governors to vote using the software that we've installed within the decision time. As you'll see in the notes, and colleagues have got these, based on today's quoracy, where we require 1/3 of the council and a member of each of the constituencies, we can't take that vote today. Our staff governors, as you mentioned earlier, one has gone into labour and is having a baby today, which was unplanned, well, planned, but earlier than perhaps we were thinking. One staff governor is on annual leave, and the other stood down after February's meeting. So the one on leave is due back on the 6th of May, and we'll contact her the moment she's back to allow us to get these over the line. And then in terms of the induction and onboarding of the non-exec directors, we'll move that at pace to ensure there's no impact on the board composition. So if you're happy, Sean, we'll send, what we'll do is Jack can turn the vote on live for the governors specifically only to vote, and then we will issue this out over email for the remaining governors that aren't present today. So we'll probably just need to give if people have got access to decision time, just give them a couple of minutes to vote on the system so we can record that. Good. Thank you very much. Dinesh?
Just a pernickety point. I agree with the process. I've just the report in section 2.1. It says 31st of April. I hadn't realized that April is expanded. So the Kevin Crowley is leaving on 31st of April.
Not the 30th. Yeah, we'll amend that, Dinesh.
Thank you.
Great. Lovely. Thanks very much indeed. So moving on, we've got the quality committee.
Sean, sorry. Do you mind if Jack just opens that vote up for those that are present?
Oh, we're doing it now. Okay, yes.
Is that possible? It'll just take him 2 minutes.
What do we need to do, Adam? Wait for the.
Yeah, so for
It's
the governor,
only the governors who have to vote, isn't it?
yeah,
Yeah.
just the governors present just to vote, and on decision time once it goes live, which it should do any
Oh, I
minute.
see. You're making it easy for everybody, which is absolutely right. Yeah. Do your stuff, Jack.
It's currently unlocked, so if you still can't vote as a governor, it might be worth refreshing, and then you should be able to vote.
So where do we find it? Sorry.
Just on decision time on item
Yeah.
8, there's a little section at the bottom that says, "Do you approve the recommendation of NNR?" And there's a vote function. If you
Sorry, I
have trouble
can't
with
see
that,
that.
No,
if you
okay.
have trouble with it, we'll take it
Adam,
offline.
Adam,
Sean.
what we'll do, let's go. When we finish the meeting, we'll either do it right at the end of the meeting, we can let everybody else go, or we'll do it offline. Yeah?
Yeah, sure, absolutely.
Great, okay, but it's a good, worthwhile trying it. The Quality Committee, Kathy, thank you so much. You're going to take this for us, aren't you? And I don't think Jonathan or Adrian are here, so we may not have the governor response, but Kathy, and again, apologies from Anna. Please, Kathy. And Rob,
Yes, I'm off mute now. Sorry. Yes, I'm standing in for Anna. I'm a member of the Quality Committee. So you've got the report in front of you, and I'll just highlight a few of the things that she and I would particularly like to draw your attention to. So obviously we review the risk scores at the Quality Committee that are relevant to our committee. There was no change in those risk scores, but as we've reflected earlier, we recognise the huge ongoing challenges across the system and the fact that we need to be constantly vigilant and constantly alert to what's happening in our services. From the safety front, there's still a continuing focus on suicide prevention and particularly increasing efforts on ligature awareness training and enhanced therapeutic observations across all of our areas, and ongoing concerns really about not meeting risk assessment and care planning targets, and there's further work going on that. And looking at patient safety incident investigation reports specifically, also work to improve the community mental health service intensive support and maintaining contacts with patients following the incident in Nottingham. So particularly that not losing patients through the system and making sure that we are recording diagnosis and we're able to follow up on those patients and maintain contact with those that meet the criteria. In terms of effectiveness, there have been improvements in our outcome measures, and especially the improvement in patient-reported outcome measures and our ability to link those with clinically reported outcome measures. That's really important. And we were also pleased to see the focus on addressing health inequalities and the new group that's been set up to do work on that. And that will also really help us identify the groups in our communities that may be underserved. So I think that's going to be a really important piece of work. In terms of experience, the target for our complaint response time has not been met, but there's work going on to tackle that, and I understand that is now improving. We looked at the LD and autism improvement standards and recognised the really good work in this area. We had a presentation on that, and we supported the recommendations in improving the resources within community LD teams and increasing the involvement of those with lived experience in the work. In terms of workforce, we're pleased to see that the turnover rate had reduced to 13.2 and the vacancy rate was down at 9.2. Appliance with the appraisal process is strong, but we need to make that a more meaningful process for people and to focus on meaningful objective setting. There's been an increase in agency usage, especially in Brighton and the CAMS service, and sickness absence remains a concern at 5.7. But again, we think that's not unusual in the context of the services we provide, but also in the context of change and uncertainty through the recent reviews that have been going on within the Trust. In terms of pay gap, we looked at the gender, ethnicity and disability pay gap, and it's really good to have that data in all of those groups. There's good progress on the gender pay gap, which was 11% in 2023, now at 10.3%. Ethnicity, 4.6% in 2023, now 1.1%, and disability is now 8.7%. So more work to do in that area, and probably the first time we've started looking at that more closely. Finally, with regard to the provider collaboratives, the main issue discussed was the decommissioning of the Women's Enhanced Medium Secure services and the increased demand for medium secure places for men. And we also noticed the continuing pressure and lack of capacity in children and young people's services. So those were really the highlights of what we discussed at the committee. So open to questions now.
Brilliant. Thanks, Catherine. But thanks, Cathy, very much. Rob, you're first, but you might have been wanting to talk about the previous item, mightn't you?
Yes, I was. It's very simply to report that I know you have had at least one successful vote on the NED vote.
Right. Okay. Right. Okay. Thank you. Yeah. Cathy. Yeah. So, Catherine.
Thank you. Yeah, there were just a couple of points from the report that I just wanted to look at in a little bit more detail. The physical healthcare highlight report, it says there were 66 site visits with complex physical health case reviews. I wonder what the common themes are and how this links in with our brain body work of our research arm. Because we know that especially with neurodivergent and people with additional needs, often those needs are very similar. So they may be around gastric issues, they may be around joint and hypermobility. So I just wonder how we are being really effective on that. So that was my first question. And the other one was about learning from deaths under 2.16. There are 23 deaths amongst patients and 13 amongst people with learning disabilities. No mention of autism. So I wonder, were those other 10 autistic patients, or because learning disabilities and autism are not the same and they're often lumped in together, and we mustn't conflate the two. They are very separate things. Someone with learning disabilities can also be autistic, but most of our suicide deaths are autistic people with no associated learning disability. And, you know, that communication and collaborative working came up again. And when we go back to the ligature increases, again, disappointing when this is one of our major causes of death. So it's just around those issues. I don't know if these could be areas for a deep dive, as we mentioned earlier.
Okay, well, Cathy, do you want to give a response? I know James was nodding, particularly around the physical health side. We'll go to Jane up, but Cathy. Oh, you're on mute, Cathy, so.
Yeah, I think it would be useful to get more detail on the themes from the site visits. We got we did get a summary from that, but it would be useful. I know dietetics came up as one of the themes you mentioned that, but we could certainly look for more detail in that report. So yeah, I'll take that back. Thank you very much. And on the learning from deaths, the differentiation, I think, and making sure that we're picking out autism or neurodiversity, if that's not being differentiated in the information we're getting back.
Yeah, well, I had a meeting with the lead for learning from deaths of people with learning disability and autism, and she said that deaths are not being reported still. So they are getting very few, especially on the autistic side. So I wonder if we are making sure we are reporting all deaths in our services to that team. And she would be happy to come along and do an item at a future date to talk about learning from deaths. And I think because one of our major focuses is on learning disability and autism and neurodivergence, that might be a really positive thing. Her name's Adele, so I can share that later if necessary. But yeah, she'd be happy to present.
Yeah, I think that would be. I think sure the other governors would find that useful, and we can follow that up when we meet tomorrow. Catherine, Jane, you want to?
So I think the report doesn't quite do justice to the amount of work that's going on behind the scenes in this. They are reported differently and through different processes. So there's something about how we're reporting to Quality Committee that we need to pick up. Similarly, the leader report, the Learning from Deaths report, comes to the system-wide meeting that I chair. So in my system role, I was disappointed that the year before last we had 5 deaths reported of autism in Sussex, and last year there were 11. Well, I do not believe there were 11 deaths of people with autism in Sussex in 1 year. So I have also challenged that, Catherine, in my role within the system. And it is both, it's not just SPFT, it's primary care as well, and the monitoring in primary care. So it's a much wider system problem that we have asked to be addressed within the system. So it's probably not a governor's thing, but I just wanted you to know that we're carrying that message as a system lead as well into the system, as well as trying to learn ourselves.
Great. Okay. If anybody, unless anybody disagrees with me, what I suggest is we carry on through the break and we finish a little early, because I know a lot of us got a meeting fairly soon afterwards, because we're slightly ahead of time. If we could go to the Finance and Investment Committee, and Abiola, again, you're going to do that for us. So thank you for that. Again, I think we don't have Mel, so I don't know whether we can have a governor response, but Abiola.
Okay. Hello, everyone. I don't normally chair the Finance and Investment Committee. I took over for Anil just for this time. And so forgive me if I miss some of the background. I'm going to just give a little bit of context just to make, because I'm not sure just where everybody is at. Sometimes when you get these finance reports, it's hard to know whether you should be worried or whether it's a good thing or not. So we've got the annual financial plan, just as a reminder. In the past with our annual financial plan, we've generally said that we're going to have a deficit, but then we did a lot of work in the previous years to not have that deficit, and we've done a lot of changes in terms of staffing, and we've done a lot of changes so that we would be in a much better financial position. But then things outside of our control happened, and we found out that actually where we thought that by now we would be in a break-even position, we weren't. And so that was a bit challenging for us. But then we were, then for this year, we were able to reduce that amount of the deficit that we thought we were going to have down to £7.8 million. And then after going, backwards and forwards, we've now got to the stage where we can get that down to a break-even point. I'm not sure if that makes sense. I can see some people looking a bit confused.
But for the year that's just gone, we're break even. We got to break even point, and that is brilliant. Yeah. Next year, we can't say much about next year at the moment. We're right in the middle of the negotiations of it. They're really quite tough, as you'd imagine, from what I was saying earlier. We can't really talk about next year. We're just not in a position to be able to. In a meeting a little later on, where the governors are going to be with us, we've also got Usman going to pop in, but he'll say the same thing. Can't say much about next year, but well done, Abiola, for your part in the break even.
Okay, all right. So going forward, so anyway, so to try and reach that break-even position, NHS Sussex will provide an extra 4.4 million. And we said we're going to try and come up with the. Jane, you're shaking your head.
Yeah, so we're right in the middle of negotiations, so we can't say what we're doing this year yet. We're right in the middle of negotiations, so it hasn't been signed off and approved. That was at that point in the negotiation, so we need to be quite guarded in what we're saying. Just I'm not being.
If that's okay, Abiola, because it's changing daily. Yeah, no, I get it. It's changing daily, isn't it? I mean, and it'll go on for a little while longer. So yeah, that's good.
Cash flow position. That's fine. Cash flow position. Cash flow position, that's still fine. I can go on to that bit now.
Yeah. Is it well? What do you think, Jane? It's probably at this. I think
this is we can talk about what's happened last year, getting to break even. What's happening in the year ahead? We are literally. I mean, I was in meetings all day Friday negotiating, so we're not in the position to share that yet because we haven't finalised it as a system at any level, at any bit. So I think that what the governors need to hear is that we are in the process of negotiating, and we will report when we've got to that finalised position.
Okay, I was talking about the cash flow position that we're already at. No.
Okay, if it relates to last year, but yeah.
If it relates to last year, yeah.
Okay, let me talk about the stuff from last year. Financial plan, financial performance. Okay, financial performance report is definitely something that has happened. we are at break-even position by month 11. And so we forecast that by the end of the year that we'll be on schedule. We've done some really good work in terms of agency spend. We've been able to get that down. However, the scale of the reduction is less than it gets less and less, because obviously we've done all the real changes, the really easy sort of low-hanging fruit changes that we can do. But that is just worth highlighting, that was a good thing that the executive team managed to do. We will have pressures around medical agency pricing rates, because obviously everyone will know, following in the news, that there have been increases in how much our professionals need to be paid. So that we'll be looking at that when we do the financial recovery. With the commercial report, I don't want to go into too much detail because about that, because I don't want people to start asking really detailed questions. I want us to stay at quite a strategic level, if you don't mind. But just to know that we did receive the commercial report. We were happy with what the executives were doing. They spoke to us about changes, different contacts that we were doing with CAMHS and with the eating disorders. We questioned the team. We asked them lots of questions about how it was going to work. They told us about some of the challenges why things were not moving as fast. But and that's reassuring to us, because we know that they're doing the work that they need to do to make sure that whatever contract that we enter into is the right one for us, and at the right time, and at the right price, and with the right people. But if anyone does have a specific question about some of the contracts that are in the paper, do feel free to ask it. I just didn't want us to just spend a lot of time on the detail of that. We looked at the board assurance framework, and it rightly highlighted that financial sustainability and the modernisation of our states continues to be an issue. It will be an even bigger issue going forward, so that shows that we're going to have to change some of the the ratings for how big the risks are on those issues. And I think that is the right thing to do, because we all just need to be very focused on that. And I do believe that the executive, the senior leadership team are on it, and that the rest of the NEDs are on it. As a committee, we reported that to the board, and everybody knows what's happening, and it's a very live issue for all of us. Are there any questions?
Abiola, that's great. Thank you very much. Sorry about that, Kavita. But it's like we said, for the next year, it's just so unclear at the moment. That's really helpful for last year, and a good positive year, really. Any questions? I agree with you that I think as with quality, there's good discussions and there's good challenges, and there are good systems in place for the finance committee to make sure that we're on top of it, and the fact that we're in good order going forward is testament to that. Thank you so much on that. And the audit committee, now Adam, help me here, because Kevin is not. I don't think Kevin's here, is he?
Oh,
he so is.
Sean. He's
Sorry, Kevin.
Yes, he's definitely here. Well, I think I am. It's
yeah. Yeah. Please, the audit committee summary, Kevin and Rob and Sarah were at the committee, so we'll be able to give a bit of feedback.
Great. So hopefully everyone has received the paper. I won't summarise the entire paper, but I'll just go through a couple of highs and lows, if that's okay. Counter fraud. It's been an improving picture, and I think both the process and now the outcomes are good in counter fraud. We're in a pretty good position, I think it's fair to say. Internal audit. It took me a number of years to get my head around internal audit. That management actions are set, that we comply with the actions, or that we push them into the future. I think I said at full board that there's been significant progress in this over the time I've been here, and that we're definitely getting to a place where it's becoming more real, where the actions that are set are genuine management actions, and where they get completed or reported back if there's a genuine delay. And I think the conversations have become, I think, really quite real about this. And I think in terms of the detail, I think the one challenge there was the IT security having a partial assurance. We did kind of query that and try to get into the detail of that and seem to be as much about reporting of IT security and the application of internal policies as genuine IT security challenges. And there was a rare moment of compassion from the committee when looking into some of the detail about security management, where we thought that perhaps having an early audit on how the EPR was going wouldn't be such a good idea, when the main thing was getting the EPR up and running for the organisation, which I'll come on to towards the end. External audit progress report. I mean, we're still in the foothills of getting it together for this year. I think it's really interesting when you have a new auditor coming in and they don't know you and you don't know them, and there's very much a getting to know each other kind of phase. And something I was always interested in about external audit was if they found out stuff that was concerning as they went through their external audit. I do apologise, through their external audit, would they report back in real time to the committee or to management? And I got quite a lot of assurance actually that they would, and that again, it feels like a real process. So new provider, but they're doing quite well, I think it's fair to say. On loss of compensations, I mean, this has improved over the years, and I think measured progress, good progress on clearing debt, and I think a lot of scrutiny on outstanding creditors and debtors. So that's going pretty well, I think. And in terms of planning for the year, so there's been a slight change this year. There's going to be an annual report summary ahead of the annual members meeting in September. So apparently that's what used to happen pre-COVID, and that's good, I guess. And there was, I think the kind of there was nothing for escalation really, but I think what the committee felt was that it's really important as we move into a new electronic patient system that the board generally and the committees have appropriate scrutiny of it, because it's a huge moment of transition, a lot of risk, a lot of jeopardy, if you like, but also potentially a lot of costs. So that there's something around triangulating, making sure that the board in general and the audit committee plays its part in ensuring that it is implemented well and that it meets the aims and objectives. And somebody spoke of that around quality, around safety, around risk management. So it wasn't quite an item for escalation, but something to be aware of, I think, so that the oversight of that program is really important. And I think that was it. Apologies if I'm doing a bad impersonation of Nitin, but that was my best impersonation.
Not bad. Very good. Thank you very much. Well, we'll find out.
And yes, any questions? I should say yes. It's not just like a soliloquy, is it? There's a call and return. So any questions from anybody on that?
Well, let's come to Rob and Sarah first, because you were at the committee. Anything?
Yes, I was the only that was actually there. Sarah had to present her apologies. It was a generally well-run committee, and the only problem I had was with jargon and acronyms. I'm afraid Kevin just committed the same sin in a minor way. I have to remind myself what an EPR is. Sorry, Kevin, you're...
shall I come back in? Sorry, the new patient record system was what I was talking about. I hope that so the new electronic patient record system.
Electronic patient record. Oh, thank you. Right. Okay. Yes, that's an example of the fact that those of you who are sort of in this system all the time will know what all the acronyms mean.
No. Good point.
We have to be reminded when we dip into the topic only from time to time. So that's just a little reminder, which was really the only area of concern, which I noticed also very much what Catherine was saying in the context of a different meeting earlier, different series of meetings. That's all. Thanks very much.
Thank you, Rob. I take your point about acronyms, and Adam saying that we're working on a acronym buster, which actually I've said known in other organisations can be very helpful indeed. It's going to be a long list. Thank you, Kevin. Any last points? Thank you so much for being on that committee and others. Okay. So moving on to finally, and thank you, Abiola, for chairing the charity committee for me. I was off at that meeting where Jane and I got summoned to see Jim Mackey and others about the future of the NHS. So Abiola, how did the meeting go? I think it went well.
Thank you. Okay. actually, I really like talking about this committee because I'm really excited about our charity. I think we've got a really lovely charity, Heads On. I think that it's run by you know, Rachel, and she does a fantastic job with quite a small team. I'm going to talk a little bit about that, you know, later on. So as it says in the report, there's been a review for the strategy for 2025 to 2030, and so the charity is aligning ourselves more. Heads On is aligning itself more with SPFT's strategy, so it makes sense that the two are, you know, are in tandem and that they speak to each other. And the executive committee did get to speak about, did get a look in on the strategy, and they, you know, they made comments, so we made sure that there was real alignment going on there. What's important to realise is with the strategy, there was a whole comms piece about it, and when I mean that, like there was, like, you know, new branding, there was a report about it. So with the strategy, the way that the strategy document is shown, it does seem that it's very outward focused. But that doesn't mean that we forgot the inward audience. So the inward audience being, you know, staff, users, people like that. The reason that the way the strategy has currently been run is to help with getting funding. So it's really looked at what funders find, how funders fund really, and what they need to know, and what's important for them. But so if there are bits in that strategy that you're like, oh, but you didn't talk about this, you didn't talk about that, it's just mainly because that particular strategy document is meant to be for, you know, for funders, to help funders to, you know, to give us the money that we need for the charity, obviously. So when it goes to the business plan, so the business plan is being driven by four main. Okay, so to talk about the business plan, the business plan shows how much we're trying to raise in, you know, in the course of up until 2030, and we're trying to raise 2 million, which sounds like a challenging target. It's important for targets to be challenging but also achievable, and so the fact that we've previously raised about 400,000 every year, that actually is still an achievable target, so to give you reassurance on that. But it does need to be a bit stretching, otherwise we're not going to have money to do what we need to do, and that is being enabled by income generation, grant making and program delivery, doing some more research work, and increasing our reputation. We realized that Heads On as a charity sometimes isn't seen separately from SPFT as an NHS body, and so for us to, you know, to have more of an impact, we really need to make more noise about what the charity is doing, which is a great and amazing thing, but how it is actually separate to SPFT. So it's important that we, you know, that we look into the media and our reputation, the way that we present ourselves. We approved that business plan. In terms of the end of year report, I don't really want to go again into too much detail because I'm trying to keep everyone quite, you know, quite high level. But we looked at all the different things that were happening, and we were satisfied that that the team were making the right decisions. They talked about allocation of restricted fundings to, you know, to other funds, which was fine. There were some services that some charitable funds, some services that closed, and so the funds had to be moved to other services that were open. That's all pretty, you know, run of the mill. The financial summary. Financially, the charity is in a good position. We're effectively holding high levels of cash. And so when it came to the financial summary, the biggest sort of discussion actually that I think is quite relevant here was about how we use money that's unrestricted. On the one hand, you want to keep quite a lot of unrestricted funds because that helps for stability. So, you know, cost of living might go up, and so you need to make sure that you've got, you know, funds, you know, for that. You know, we want to have a good central team. We want to be able to pay salaries. We want to, you know, do lots of admin things that are not linked to projects. And actually, it's also quite good for funders when they want to fund you. They want to see that you are sustainable. But then on the other hand, you don't want to have so much money that's just sitting there and not doing anything sensible with itself. So some other charities or some other organizations may decide to perhaps invest that money so that we can get interest rates, higher interest rates, and we can generate income that way. But obviously that's a risk because, you know, what do they always say in adverts? You know, with investments, you can lose money or you can make money, and, you know, it's always at risk. And so we just had to be careful that, you know, that we get that balance right. So we looked at, could we invest in, you know, property? Could we use our property in different ways? Could we focused quite a lot on property. I don't know, maybe that's just the interest in the team, you know, at the time. But it's just that we are looking at that and looking at whether we have risk appetite for that, given the sums that we, you know, that we have available. If anybody has any comments as to what they think our risk appetite should be, we'd really love to, you know, just to get your views, really. Risk register, again, about reputational risk. Recognising that the charity is linked to SPFT, we do have to bear in mind that there could be a knock-on reputational risk on the charity because of how people view SPFT. So obviously we have to adjust our risk that way. The other thing, so I did want to say, and I said I was going to get back to it, we have a very small team in the charity team. And so when you look at the amount of funds that they're able to bring in and all the different activities that they're doing, they're working really, really hard. I mean, some of them are not even full time. And so as a committee, we did acknowledge what they were doing, and we made sure that that was minuted, so that they will, you know, recognise that even though we only ever see really Rachel, the CEO, we do recognise that she is supported by, you know, mainly women, to be honest, behind her, who are doing a lot of good work, and so we did just want to thank them for that. Does anyone have any questions?
Well, we'll throw it open, but just to say, yeah, I love your enthusiasm, Abiodun, and I share it because it's a good charity. It's great that it's in a good financial position given how we are, you know, across the country. I like the links with R&D. We're a teaching universities NHS trust ourselves, so we invest and we value research and development. We want to raise the profile of that a bit more, but the linking that with the charity is important, and Rachel's got good relationships there. So yeah, thank you very much. Anything from anybody? If not, look, really, really grateful. Thanks for your time. If there are any other business, there is from Sarah.
Hi there. We had a question come in from Jonathan Simon. I don't know if it's relevant to bring that up here. Okay. Are you happy for me to do that?
Go on. Yeah, and we might need to take it outside, but
okay.
Yeah.
So Jonathan asked, in the light of the recent Supreme Court opinion on the legal meaning of women in the Equalities Act, what are the implications for the trust, its workforce and patients? And I know that Jane is preparing something on this, and I wondered also if Simon Blake wanted to say something on this as well.
Yeah, well, Simon?
I'll just put the battery in my laptop before I start.
Sorry, I didn't mean to put you on the back foot there, but Jonathan asked me to raise this.
Shall I start before and then start as Simon's getting his battery?
Yeah.
So I think we've got to be really clear on what the media is reporting and what the Supreme Court ruling actually says are two different things. I think that's what I need to say to start with, and that we want to be compassionate and equitable as an organisation, and I do not propose doing anything until we know what the code and the translation of that means into practice, and have no knee-jerk reactions, but be open and listen and to be supportive of all of our colleagues, whether they be trans or not, whichever side of the fence they sit in this national debate, that we're kind and compassionate to everyone, listening to people, but also not doing any knee-jerk reactions and sort of quite media type responses to it.
Well said. Yeah, good. Simon?
I was. It's almost as if Jane and I were sitting comparing notes. I think it's really important to say that there are conflicting views about what people believe it means, and that the media is reporting all of those, and individuals are reporting all of those. And there will be a process by which the statutory code of conduct that currently exists is repealed, because it's a statutory instrument, and that the new one is adopted. And the timeline for that hasn't yet been agreed, even though it has been talked about. And so the position of being absolutely clear about what does need to happen, when and how is the right one. And that, yeah, I think that's probably as much as there is to say really at this stage, Sarah. And obviously the NHS, there will be particular guidance and things which are already part of the discussion and thinking in relation to wards, etc. So, yeah.
Thank you both. I will relay the essence of that back to Jonathan.
Great question. Yeah, lovely. Thanks very much. Well, look, seeing most of you again at 12 o'clock. Thank you very much for the meeting. Thank you for your time.
Sean, can I just actually, I think what Catherine has just put in the chat is an important bit to add. That the ruling does explicitly state that it does not remove protection from trans people. I think what people are really clear trying to work through is, what does all of that mean, and how do these two things now move forward? But yes, you're absolutely right. It's a really important part of the thing which everybody needs to hear.
Good.
Thank you.
Yeah, well done, Catherine, Simon. Thank you very much. Okay. Bye now. Bye-bye.